Regional Australians are more at risk of skin cancer compared with people living in major cities. And at the same time, their access to healthcare, including skin checks, can be limited. But an Australian scientist is developing a tool that could identify skin cancer with a simple patch test.
1, 2, 3.
A pre-screen for skin cancer in just seconds. The first clinical trials of the DermR skin patch in Western Australia's remote Pilbara region.
You've just contributed to, hopefully, a new way to screen for skin cancer.
The technology harnessing the power of microneedles with the hope of one day delivering a painless and convenient way to identify cancerous lesions.
Microneedles are painless. They're less than a millimetre long. They penetrate about a millimetre into the skin and they collect a micro amount of tissue. You feel a little bit of pressure, but the amount of tissue that we collect is actually enough to perform a genomic analysis.
Sydney-based genomics specialist Stefan Maisie believes the technology could be an alternative to a biopsy.
And that's probably the most amount of pressure that you'll feel.
When a sample of cells or tissues is removed from the skin, typically through an incision and carried out by a GP. The microneedle patch, he says, is a far less invasive option.
There's no pain, no bleeding, no cutting.
Though patients who do have signs of cancer will still require a follow-up biopsy.
I guess the whole idea is to triage. So, which patients do need to get medical attention and which patients don't.
Around 2 in 3 Australians will be diagnosed with some form of skin cancer during their lifetime. And while those in regional areas are most affected, access to healthcare can be limited.
Rural and regional Australia, we know that we carry a significant burden of skin cancers, and the access to specialised skin cancer services is reduced. That being said, it's also the bread and butter work of rural GPs.
GP shortages often a barrier, but the microneedle skin patch will be able to be administered by a nurse. Professor Pascal Gutera, a dermatologist at the Melanoma Institute Australia, believes this kind of technology will be the way of the future, but she adds it's still early days, citing concerns around the cost and accuracy of the technology.
It's because it's complex, and we have also a lot of diagnoses that are not white or black. They're grey, they are sentient, so they need a lot of skill and a lot of experience from the doctor to do that. Of course, I would not say that because it's complex, we should not try.
Other experts say if successful, the patch could be a useful diagnostic tool.
If you're a country patient and you have a simple sort of investigative technique and it says actually this is a skin cancer, then you can prioritise the next step.
A second, larger clinical trial is expected within the next 6 to 12 months. Abby O'Brien, SBS World News.